Hello, everyone. It's Monday, September the 14th. Very regretfully, since Friday, I've got to announce to you that we've had 12 additional deaths in West Virginia. We're up to 275 now. Our country is racing towards 200,000. Our 264th death is a 90-year-old female from Jackson County. Our 265th death is a 74-year-old male from Marion County. Our 266th death, an 81-year-old female from Logan County. 267th death, a 91-year-old female from Cabell County. A 268th death is an 84-year-old female from Kanawha County. A 269th death, or the 269th death, is a 78-year-old male from Grant County. Our 270th death, a 66-year-old male from Harrison County. Our 271st death, an 86-year-old male from Harrison County. Our 272nd death, a 76-year-old male from Harrison County. Our 273rd death, a 75-year-old female from Kanawha County. Our 274th death, a 71-year-old female from Kanawha County. And our 275th death, an 83-year-old female from Kanawha County. Of all these people, the youngest of the 12 was 66 years old, all the way up to 91 years old. You know, you can see, and it doesn't take a rocket scientist to see that this disease, this killer, absolutely attacks our elderly first and foremost. All I can tell you over and over is all these people have a name. All these people were tremendous contributors to West Virginia and to all those that they loved. So please, please remember them in your thoughts and prayers. Some way, somehow, we're going to get through this, but it's there's no doubt really tough going, especially for these families and these people. Today, in regard to our numbers, we had 121 new cases in the last 24 hours. Our daily positivity rate is at 2.69. That's the lowest it's been for a good while. That's good. You know, we have had a total of 1,223 new positive cases in the last 7 days. Our active cases are now at 3,184. That's up 335 cases since Friday. Our recovered cases are 9,361. We have 151 people hospitalized now, up from 147. The map, if it were to come out today, would show Mon County in the red and 11 counties in the orange. That's Ohio, Calhoun, Pocahontas, Putnam, Kanawha, Fayette, Lincoln, Boone, Monroe, Logan, and Mingo counties. We're still the highest in the nation in our reproduction number, which is at 1.34. We're down from 1.46, but we're still the highest in the nation. Now, let me tell you this. Today, I want everyone today we have a situation. Let me go back to this. We have a situation in Kanawha County with Bible Center School. And they are taking it on themselves to just ignore the executive order that the governor's put in place and go back to school. All I would say is just this. Kanawha County is having all kinds of issues. While as respectful I am in every way that you could possibly be to our religious beliefs, to our children, in every way you cannot find someone that stands in your corner more than I. But this, we know, exposes us. And absolutely, if we branch out on our own and we start doing things on our own, we're going to cause a lot of heartache to a lot of different people. Now, from the standpoint of running down and say you're violating the law, well, you know you are. And it's a crying, pitiful shame that for some reason, whatever it may be, and God forbid it has anything to do with economics, but it could. But absolutely, without any question, making a decision because you feel like in your mind that it is safe for your children, what if it's not? We know in Kanawha County we have a colossal issue right now. I think our health expert in Kanawha County, Sherry Young, came out and said, really a bad move. Really does expose. And I hope and pray some way, somehow, we'll get on the same page with one another without ending up causing any more pain or ugly scenes or whatever it may be. Now, let me just tell you just this. Whether you buy it or don't buy it, the nights are tough. And the sleep is not much. And I can tell you that this is really, really serious stuff. I can tell you I'm honored to be your governor, but it weighs on anybody, and it's surely weighing on me too. While you're lying there and you're basically staring at the walls or staring at the ceiling in the middle of the night, surely not sleeping, and you're worried, and you're wanting to make the right decisions. Everything in my power, I am trying with all in me to make the very best decisions for all of you in West Virginia. I am also praying constantly that my decisions are the right decisions. So with all that being said, I want everyone to know just this, that today at 5 o'clock, I'm again calling all my advisors in person to come to the governor's mansion, and we're going to again turn over every rock and look at every feasible possibility to be able to achieve safety, goodness, absolutely to achieve the things that we want to achieve that would be the very best for our people in this state. You depend on me, and you've had incredible faith in me to make the right decisions. I'm going to continue to do that. And I'm not going to be pressured by anyone, that may be protesting or anybody that's going to be trying to exert pressure from D.C. or wherever it may be. I'm not going to bow down to any of that. I'm going to make the very best decisions that I can make through my gut and my brain with the advisors that I have from the medical team, the education team, the guard, all the different people that I can have that are supplying me information. Now, I've told you over and over, this is a pandemic and there is no playbook. It would be plain stupid to be stubborn and not change and adapt as we go forward. It would be plain stupid to not do that. So we change and we try to make it better. Just like when I got winds of the situation with the bands not being able to perform. Ridiculous. And I don't know how we got there, but we did get there some way. We changed. Well, now here's where I think that we have some level of fallacy that we can have room to change. You see how I see this situation, and I have not presented this to our experts, and I'll be doing this today. Well, I take that back. It has been presented over and over, but we have stood our ground in following the Harvard model. Now, when we go orange, the difference between counties that may slightly, very slightly, have been in the orange, like 11 or 12, 12.01 or 12.3 or 11.6. Do you realize the parameter of orange is so wide, in my opinion, way too wide. But it goes from 10 all the way to 25. So basically it captures a county that may be an 11 and calls them the same as a county that may be 22. I don't think that's fair. And I think it's something that we need to look at and look at again. And that's what I'm going to present today in the meeting, as well as many other things that I'm going to go over with you right now. I think that we can make things better by continuing to be light on our feet and changing. I absolutely do not want us to be stubborn in any way. Now, from the standpoint of Mon County today is like 38. They're so red in Mon County that they're off the chart red. And of no question, a big contributor to that has been WVU. Now, the people at WVU are doing an amazing job. And President Gee is a superstar. I don't care what anybody says at any time. They are doing an amazing job. And they're trying with all in them, just as we are here, to try to do the right stuff. Mon County is absolutely in a situation, and it's being influenced by WVU, I'm sure, as well as within Mon County. You know, we've seen it, you know, from the standpoint of closing and opening the bars, and what happened? It happened within 2 days, and we shut things right back down. We have seen what's going on there and the dangers and the exposure and what it leads to. One thing that is on the table, and I don't know why we can't get it across the finish line, and it's just this, and this is, and maybe this is not the concept, but maybe it is. You know, we have a great many students that have tested positive. From the standpoint of those students, you know, we can't make it mandatory that those students go home. We can't do that, but we can't deny that either. You know, we can't take a positive student and demand they go home and maybe make things worse where they go, but we cannot stop that. That is the choice of the parents and the student. Now, but one thing absolutely that I would hope that we can come up to some kind of solution on what we can do. If we could take the kids that are positive and we could put them into a couple of facilities, into dorms, to where we're taking care of them, we're feeding them. Most all of them don't even have symptoms. But we could keep them there and let them continue to do their schoolwork online and everything that they're doing, and assist and help them in every way. What could we do? We could actually be able to get them well and get them back out of the dorm and back into their normalcy in their life in such a more expedited manner, and we could keep them from exposing others and exposing others and exposing others. And in addition to that, because they're in a congregate setting, we could count them on our color code thing as a 1. Instead of counting them 1 to 1 to 1 to 1 and blowing Mon's numbers completely out of whack, we could count them differently. Now, we have got to come to that solution. We have got to come to that solution and come to that solution immediately. Now, I'm not positive that is a solution, but at least it's an idea. Now, from the standpoint of our sports, of course, you know I'm a coach, and I know if our coaches are with our kids and they're watching our kids all the time, and they're wearing their face protections and all that kind of stuff as much as they possibly can and everything. And they're seeing those kids come every day, every day, every day. And the natural reaction is, well, we don't have a problem with our basketball or with our football team or our soccer team. Well, you don't really know. I offered to be able to play with some level of testing. I'm going to go back and revisit that again today. But the biggest thing I think what we need to do is just this. I think we need to look at adding a color into the color code system that it enters right in above yellow. And I think that color should be gold, because that to me is the blend between maybe an orange and yellow. And so if the gold parameter could be entered, and this is what I'm going to suggest and discuss, and that gold could go from maybe a 10 to a 15 or a 10 to a 16, and then from 16 to 25 is orange. And I completely believe without any question that we should not be in school, period, in the orange. But we've got counties that are only so slightly into the orange category. And so slightly, I mean only maybe 1 or 2 or 3. And maybe the only difference, the gold is much smaller. Maybe the gold is only from 10 to 13. But what I am so saddened with is you have counties, I hate it like crazy, that have not even had the opportunity to start back to school. They can't even start to school. And we need to try with all in us to do something about that. Now, we don't want to make the situation any worse for a teacher or service personnel or kids. We don't want to compound the situation. But I think we've at least got to take an open mind and really look at the indexing, the difference between 10 all the way to 25. You see, we went from 0 to 3 in green, and we went from 3 to 9.99, I guess, in yellow. And we're going from 10 to 25 in the orange. It's too wide. It's too wide. And the other thing I would do is I would do just this. I would allow the teams, the sports teams in the gold, if we put in another color, I would allow us to go back to school in the gold, and I would allow our sports teams to play in the gold and play any other team, any other county that would be in the gold, or play within the county in the gold. I want to discuss how we address that from the standpoint of attendance at the games. I don't know if we're going to, if it comes to that we're going to pivot back and say that what we're going to be able to do is we're going to let parents only go to those games, or maybe we don't have, in the gold area, we don't have any spectator in the stands. We need to look at that. I think we need to change anything whatsoever if we're in the orange, from the standpoint of conditioning, yes, contact, no, and if we stay within the orange, however the orange comes down, I think that's the way we should stay. Now, from the standpoint of our bands, I have no earthly idea why we can't divide the band and have the band have the opportunity to play at different times throughout the game. I do not know why we're only allowing the bands to play one time during the games. And I guess at the end of the day, all I'm saying to you is just this. It's plenty tough for everybody. It's tough from a daycare issue. It's tough from an economic issue. It's tough from worry. It's tough from sickness. It's tough from numbers going up It's tough from the medical teams. It's tough in every different way for everyone. I can tell you this. I am trying with all my soul to continue to change and adapt this system to where it works, and it works the very, very best for all of us. It keeps us the safest, and it continues to work, or it works in a better way for all of us. Now, in addition to that, I am going to look at counties, if they remain in the orange and or red. I am going to look at additional things that we can do within those counties from the standpoint of things that we need to shut down to make things better. From the standpoint of our kids, it doesn't really make a lot of sense that a ball team that has practiced and worked as hard as they have, or a kid that really wants to go to school as much as a kid wants to go, it doesn't make a lot of sense that we continue to let other things remain open and them not be able to do what they really would like to do. Now, we all know when you throw kids into school, we all know that you've got them into a closer proximity to one another, and you raise the risk. We do know that. And we also know that you raise the risk to our teachers, or you raise the risk to everybody that's there. We know that. And so from that standpoint, we're absolutely, and it's very difficult to argue, well, why do you let Walmart be open and our school can't be open? It's different. It's really, really different. And we're, again, the health community, all of our experts are saying, hold on now. When we go into a school setting, it is going to be much more exposure than it would be in a Walmart. So with all that being said, what I am doing is I am calling an in-person meeting at 5 o'clock. I want to especially look at the parameter of the color coding and the narrowing of our orange exposure. I want to look at the WVU situation and see if there's anything that maybe we can add to that situation to be able to help in Mon County. I want to absolutely visit whether or not, if we narrow the orange area, the ability, I'll give you another perfect example. Monroe County. Monroe County had the terrible outbreaks over there in Monroe County, from the standpoint of the nursing homes. Today Monroe County is like 11.01. Kanawha County today is 22. Should we treat them the same? Of course we shouldn't. It's too wide. It's just plain too wide. And so, with all the sleepless nights, with all the staring at the walls and everything, and all the tweaking that's already done, I absolutely believe that we should continue to do just exactly what the people that were enabled us to land astronauts on the moon did. They tweaked, and they tweaked, and they tweaked, and they tweaked until they got it dead level right. We're dealing with a pandemic that no one has ever dealt with in our lifetimes. We dealt with a moonshot that nobody ever dealt with before. Without any question, we have got to adapt and got to change. We're trying to do it and make it as amenable and as right as we can possibly make it. We're wanting to make it as safe as absolutely possible, and I can assure all of our teachers and service personnel without any question, we're not going to go and ask you to go to a school and do your services and everything unless we feel like it's safe. But at the same time, first and foremost, all of you know my love for kids. All of you know my love for kids. And without any question, if you think Jim Justice is going to put kids into a situation that's unsafe, you've lost your mind. And I don't care what the pressures may be, I'm not going to do that. I am just trying to make the situation and the situation we're dealing with today better. Now, let me go with a few announcements here real quick, and then we'll wrap this thing up. But the school map that came out, over the weekend, we had 7 counties in the orange: Putnam, Kanawha, Fayette, Boone, Logan, Mingo, and Monroe, and 1 county in the red, Mon County. We've still, at my direction, the National Guard, has put together the kits for every school nurse, and they're continuing to work on that, and we've got plenty of PPE, and we're going to just continue to move along in a positive way there. We've got 35 outbreaks in our long-term care facilities. Our churches, we now have bumped up a little bit. We have 6 outbreaks. We've added the Fayette County new situation there. Mingo, Kanawha, Wayne, and Wyoming counties. I want to talk just 1 second about Fayette County. Fayette County is a beautiful, beautiful county. It's not far from where I grew up and everything. I know a lot about the rivers and everything, Fayette County and everything. And I think over this weekend, the golly season down on, the river rafting and all of that came into being and everything. And from what I understand, and whether it be Fayetteville or Oak Hill, we had just an influx of a lot of people and everything. Us not doing the things from a social distancing and everything as much as we should have done, that's a real problem, Fayette County. And really and truly, we're not going to do that. We're just plain not going to do that. So absolutely, you need to tighten yourselves down and pay attention to what I'm saying, because we're not going to do that. From a corrections update, we're down to 25 inmates at Mount Olive. At the Beckley Correctional Center, all the tests conducted last week are back, and we have no new cases to report. There are 29 active corrections employees cases, 18 of those Mount Olive and 7 in Beckley. And did I say 20? If I said 29, I meant to say 25. I have declared this week an assisted living week in West Virginia for all those residents and everything that are working and living in the assisted living, communities and everything. I commend you. You have, and I encourage you to reach out to your loved ones and that are, that are there, or that are or your loved ones that are at home. Again, encourage one another to continue to do the great stuff and keep your distancing and continue to keep doing good work as you've done there. Our small business grants, we're up to $15 million there, 3,700 applications. September 30th, we're done with that, so you've got to hurry up and apply. We've sent out now with our cities and our counties approaching $110 million. Continue to apply. We're going to continue to send the money out. This testing thing is really important. We have free testing this week in Fayette, Calhoun, Boone, Doddridge, Nicholas, Harrison, and Kanawha counties. Take advantage of this. Come on. Please take advantage of this. The more we test, the more we learn. We've got 99% of our residents so far in the state of West Virginia that have been counted. We're the second biggest response in the entire nation. I thank all those that helped me in this and everything. And I ask and I urge all those that have helped me, continue to help me on these other situations that we have going on. It'll really, really be meaningful to all of us. The last thing I have is just to plead with you just this, that staying together has really, really helped us in this state. And as we break apart, no matter what it may be, and as we break apart in an effort to try to, whatever it may be, if it's from the standpoint of the Bible Center, it's from the standpoint of a football team, it's from the standpoint of whatever it may be, if we break apart, we will fragment and we will absolutely cause ourselves more and more and more grief to be able to get us all back together. Really consider just this. love your neighbor. Love your neighbor. Love yourself. And absolutely, we've got to continue to pull this rope as West Virginians. The only thing I'm going to show you is on our charts, the positivity, daily positivity rate. You know, not long ago, we pitched numbers like 7.52%. And you'll see in the middle chart, we've just gone down and down and down, and that part's better. It's not better where we've lost 12 people, and it's not better in certain counties, and those counties, we really, really need your help. Absolutely, we need help today in Fayette County. We do not need to let the season on the Golly just spoils so much for Fayette County. We need extreme help in Mon and Kanawha counties. So please, everyone step up, wear your mask, try to help in every way you possibly can. That's all I've got right now.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon, and in following what the governor has presented, certainly this unprecedented pandemic does really require us at all times to be constantly reevaluating how we are responding to the public health issue in the state of West Virginia. And as we look at the schools and look at the coding system and look at all of these other issues, the governor has been very consistent in two things. So number one is keeping people together. And we know that perhaps is the single most important element for us to continue to do as well as we have done. And number two is protecting the interests, the health, and the well-being of West Virginia residents. And I think that as you start to look at schools and children, as has been said in many different ways through different forums, that we know that it's really important from a development standpoint and from a services standpoint to try to get our children back to school as is safe and is responsible to do. And as we start to look at the community spread of COVID-19, we have been very consistent in really asking West Virginia residents to do the things to protect yourself, avoid the 3 C's. We now know from a study from the CDC that people who are diagnosed had symptoms of COVID, about 140 or 50 people who tested positive versus another similar size group who tested negative, all had about the same exposures to places like gyms and bars, etc. But one of the differences is there was a twofold increase in self-reported eating in restaurants for people who were positive for COVID-19, and I think that was particularly indoor restaurants. And we know from coffee shops and from bars and even from gyms and now from some data with restaurants that it's not necessarily a causal issue. You shouldn't be scared to go out. But I think that what this says is we are all indoors and we're in places where we take off our masks, that does enhance that risk of person-to-person spread. And ultimately, that's the reason why we want to be really extra careful as we are looking at, the mitigation efforts in the community and in businesses, as well as schools. So as we go forward, I am looking forward to the conversation that we'll have tonight. Certainly, we want to be flexible. There's no playbook for this. There's no real rule map, but we do want to make sure that we are consistent in working with the governor, and certainly the governor is the CEO of our state, and it's his decision to make. And what we will do, we will support him and the state in the best way we possibly can with looking at the issues from the health and the safety and the well-being of our citizens, but also making sure that we are flexible and we are learning from our experience, and we're making sure that we are providing the right opportunities to all people in West Virginia. So thank you very much.
Thank you, Dr. Marsh. Next, we'll go to Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer.
Sure, I'll go ahead. Good afternoon, everyone. I do want to remind everyone about the upcoming flu season this year. It is very important for everyone to make sure they talk to their doctors about getting their flu vaccine. With COVID-19 on the rise, we do want to make sure that the flu vaccine is also on the radar. If you have any high-risk conditions such as heart disease, stroke, lung problems, it's very important to have your flu vaccine this year. If you're older than 6 months or over the age of 65, it's imperative that you do have it. We also want to remind everyone that it takes about 2 weeks for your body to build up your antibodies for the flu vaccine. So the typical time for the flu vaccine is the end of October. So you'd want to think about it before that time, but it is important to get your flu vaccine this year. So we do want to remind everyone about that. Thank you.
All right, thank you both. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Continue to work with Department of Education and rolling out more Wi-Fi installation for use by our school systems and our students. As the governor mentioned, the bulk of the PPE kits for the nurses should be delivered by the end of the day today. Continue to work a significant amount of testing lane support and sanitization missions. We also sent a crew of helicopter crew members to California to help with wildfire response activities out there. And as Dr. Amjad pointed out, important for us in the Guard to keep the health of our force up because you rely on us to respond to emergencies. So we'll be putting in a significant effort over the next couple of weeks for all National Guard personnel to get the flu vaccine. And we'll also be working with our National Guard families to assist them in getting flu vaccines so we can keep our force healthy to take care of the citizens of West Virginia. Thank you.
Thank you, General. Clayton Birch, West Virginia Superintendent of Schools, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Amanda Barron with WSAZ.
Hi, everybody. Amanda Barron with WSAZ. Governor, I know you have said that obviously we are dealing with something that is unknown and we're, changing the game as it goes to best suit the situations. But are you concerned that making so many changes to the metric is sending a message of instability or that it's just confusing to people and people are going to get frustrated? Talk a little bit about that, please.
No, Amanda, I'm not. Really and truly, considering that we're plowing ground that has never been plowed, the amount of tweaking that has been done, is almost nothing. Really and truly, we have, if you try to add up what's been changed, it's almost insignificant, and it hadn't really amounted to hardly anything. From the standpoint of should we change and should we adapt? Well, if we don't, then we're absolutely stubborn. That's just all there is to it. What we should do is we should take the information that flows to us and process it constantly, and then make the very best decisions that you can make. Amanda, I've done lots of stuff in my life, and that's why I've got a lot of white hair. And I've probably made a lot of mistakes along the way, but I've pushed a lot of right buttons as well. Now, in doing so, I absolutely am conditioned to be able to handle the big stuff and to handle the big stuff properly. But I can tell you that never in my life have I seen anyone or been lucky enough myself to absolutely have split the bullseye on the first shot. There's no way. There's no possible way. So what do? You change and adapt and make it better. And that's what we're going to continue to try to do.
All right, thank you, Amanda. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News, and this might be a question that's best answered by Dr. Marsh. Could you talk about the numbers of the averages and how those relate to the associated risk? Under the current standard, we would stop having school within that 10 to 25 range. Now we're moving the number up. Are we just changing the number to get a different outcome? How does that actually, apply to the risk that people are facing?
Dr. Marsh, before you jump in, let me just say this. Charles, I think your question is a little premature because as I've given you my views, I have not given you the views of Dr. Marsh and all of our panel and all of our experts. I've thrown out my views for everyone to start digesting and think and go through every aspect of it at the meeting that we will have, an in-person meeting coming at 5 o'clock, from everyone, from General Hoyer, the SSAC. We want everybody to be there because I personally believe primarily that the orange color code is too wide. It's just plain too wide. And I think we need to try to do something about that. And I also believe that with counties that can get themselves down into a level that is very, very, very close to our being into our yellow category, then I believe we ought to try with all in us to help them not only be able to go to school, but help them be able to participate in sports. I'm a coach. I know how much we watch our kids. I know how at risk we have so many of those kids that we're going to possibly lose because sports holds them together. So I know the importance of sports. First and foremost, we want our kids in school. We want our kids in school. But secondarily, absolutely, if we can find a mechanism and a way to allow our kids to be able to compete and play sports and everything and keep them together, and maybe even test more, all of those things will help us. But anyway, Dr. Marsh, I didn't mean to jump in front of you, but I think it's a little premature because we've not discussed this at length.
Governor, you really answered the question the way I was going to. As we go forward, Charles, the Harvard model that we followed was really a model that was just agreed upon by a number of public health people. There's nothing absolutely magical about a single model. And as we look at the state of West Virginia and try to understand what is the best thing in total for all the citizens and the state to give everybody the best opportunity to continue to thrive during this really unprecedented time, then those are the types of discussions that we're going to have later this evening. So thank you.
Great, thank you, Charles. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Governor, or whoever is appropriate, could you give us a little more detail about who will be participating in this 5 p.m. meeting? And then there are members of the public who have heard foreshadowing today about the topics discussed and decisions that might be made. But when will we hear what was actually decided? Would that be Wednesday or would it be sooner? Thank you.
Okay, I think I can answer all this. I may miss somebody, but Secretary Krause, Dr. Amjad, Dr. Marsh, General Hoyer, Clayton Birch, myself, some of my staff. Have I missed anyone? Oh, and Bertie Dolan from SSAC, but I don't think I missed anybody. I don't think. Okay, and from the standpoint of when you'll know, look, and Brad, what's driving the whole thing for me is just one thing. And it's just this, is some of these counties, Putnam County, has been just slightly over the edge. They haven't started school yet. Fayette County has not started school yet. They've been just slightly over the edge. I'm telling you that I have felt, I feel it more now than ever before, but Are we right having this range of the orange so much? Are we right in trying to look at today a Monroe County at 11 and a Kanawha County at 22 and think that they are one and the same and should be treated the same? It doesn't seem right to me. And if I can come up with a way to tweak the fine-tune dial just a little bit and help things for those counties and make it in a situation to where hopefully Kanawha County will get itself down into the gold and then down in the yellow from there and everything. You know, when you get into a situation to where really and truly, and we're not, I mean, I'm not suggesting to do this just so we can put more counties in the green and yellow. I'm not suggesting that. I am not suggesting in any way, shape, form, or fashion that what we do is do something here that exposes us from a safety standpoint even greater. I don't want to do either one of those. But what I want to do is give us the motivation and the chance to feel like things are going to be better. What if you are a Kanawha County today? What if you're a Mon County today and you've got the influx of WVU on your numbers and we can't come up with a solution? We can't come up with an answer. I mean, what if you're a Mon County today? Just think about this just for a second. I know this for a fact. You've got Mon County athletic directors that are basically recommending, I take that back. I don't know that absolutely, but I have heard, let me say it that way, that we have people recommending that people that are playing fall sports go and play club ball. Well, as soon as they go do that, they're probably going to become ineligible to play on the school. You know, so it literally, there is so many repercussions of what we do and how we change. It is just so important. And so from my standpoint, what I feel in my heart, and maybe all of my advisors convince me that it is not the thing to do. And maybe we end up meeting and coming out of it and doing zero. I hope and pray we don't. I hope and pray, whether it's my ideas or somebody else's ideas, we come up with a better mousetrap than what we already have, and what we've done is really good. But it doesn't mean that you can't make it lots and lots and lots better. So in that, you know, we meet. And that's what we do. Good gracious, we meet and we talk and we meet and we talk and we just keep trying to get better and better and better. So that's who's in the meeting. And as far as when you'll know, I am very, very hopeful that after we get through meeting, that we'll come back over here and we'll give you about an hour's notice, and we'll come back over here and I'll sit in front of you and tell you if we have changes or tell you that we don't have changes. And the reason I'll do that is because if we do have changes, I want us to be able to react to those changes, and whether it be school or it be sports or whether it be, you know, having to close some additional things in counties where we're really not getting anywhere, or whether it be WVU, I want to tell you the changes so that we can react to them and react now. I don't want to come to you and say, we're going to look at changes starting 3 weeks from Friday. There's no such thing in my life. I'm the most impatient person that you've ever known, and I want everything done now. And so we're going to go meet, and if we come and we have changes or we don't, I'll come back in front of you. I'll give you an hour's notice to when we adjourn, and then I'll come right back in front of you and tell you what we've decided.
All right, thank you, Brad. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. Governor, getting lost a little bit, maybe, I think, in the discussion about possibly changing the map. Let's go back to what you opened up with after your initial announcements with the decision by Bible Center to have school, and we're told that another private school, Calvary Baptist, has also opened its classroom doors. You say they're breaking the law, so what exactly are you going to do to enforce that law, to close those schools and send them back to virtual learning if that is the color that is governing their counties? I mean, what are your options? You said you hope you guys can get together. doesn't look like you're together right now. So what tools do you have in your toolkit to persuade or force those schools to follow what you say they need to do? Thank you.
Well, first of all, Kenny, our people have been in contact with them and talked over and over and over. There's no way that I can make this sound any better. And there's, you know, the one thing I really always pride myself in doing is telling you the truth. I don't think they ought to be doing what they're doing. And I think it's a shame that they're doing what they're doing. You know, because they're deciding against the knowledge of all the health community, especially in Kanawha County, where we've got a real problem. And they're just embarking out on their own because they believe, you know, that this is how it ought to be. Now, I truly believe that in their hearts, they believe that there's not an exposure. And I believe in their hearts, they think that their kids need to be in school, as I do too. And they believe that they're safe and they're doing the right thing. And I have all the respect in the world for that. Now, from the standpoint of going down there and saying, you know, sending the state police down there and everything and trying to get it straightened out that way, we're not going to go that way in the beginning. We're going to try to go away, you know, where we talk and we try to persuade and everything, and we just step back and evaluate. You know, if we have to be enforceful, well, we'll be enforceful. But you know, I really probably need more guidance from the standpoint of an executive order versus freedom of religion, and I am super respectful of both, and so it's I think that I really just believe they're doing what I don't think is right, but evidently they do, and so we're just going to try to work it out. I mean, you know, we're sure not going to, you know, run down there and try to make a scene. We don't need to be doing that. We just need to, we need to try to do what I've said over and over and over. Together, we'll make it through this. When we start doing this kind of stuff like this, we're going to get ourselves deeper and deeper in the problem. You know, what happens? What happens if two of those kids are asymptomatic at this point in time? What happens if we get some level of outbreak? What happens if they go home and they, two other kids are introducing it and they go home, and then all of a sudden, lo and behold, we get two grandmothers that die. You know, I mean, we have got to realize that in this situation, you can only solve this problem legislating for the masses. When you try to deal with every single exception and you do that, you're going to get yourself in big trouble. And so I would plead with them to give us some time and let us try to figure out something that works for everybody.
All right, thank you, Kenny. Next to Taylor Stuck with the Herald Dispatch.
Hi, everyone. It's Taylor with the Herald Dispatch. So in Cabell County Saturday, the DHHR map went from yellow to orange. And so that kind of freaked parents out. And then there was confusion because then the Department of Ed map, we were still yellow. So I was just hoping someone could walk us through this process again. What should parents on Saturday be looking for? How can you monitor this situation without confusing yourself and panicking yourself? How can you just re-walk us through this process?
Taylor, let me make just a statement, and I'm going to turn this over to Dr. Marsh, if you're, and let him explain the panel, because I have tried to remove myself from the panel and let the panel do their work and everything, and they did their work, and then I was called by Dr. Marsh, and Dr. Marsh gave me the panel's results, and I said, go with it. Now, but Taylor, here's the thing that everyone has got to understand. When all of a sudden you've got a pandemic, and then someone says, well, come up with a system, write a system that's going to make it work for 55 different counties that are so different, all the difference in the world. Counties that have almost no cases whatsoever, and counties that are bright red today. Counties with a major university in them, and counties that are extremely rural. Counties that have nursing homes that flare up, and any kind of numbers can influence that county's numbers and make them, go from green to red, boom, instantly. Unless we tweak it, unless we understand it, how to do congregate versus community spread. This thing is enormously complicated with a lot of great people that are inputting numbers. It is the very best system that we could possibly have, and yet okay, this is a perfect example of what I was just talking about earlier. You've got a color code system that is enormously complex, and you've got us trying to talk to you virtually, and we can't keep that always going either. So in every one of these things, you're going to have to bear with us. We're going to have to adapt. We're going to have to change, and we're going to have to keep moving and moving north. But Dr. Marsh, if you'd jump in, if you want to say something about that last question, in regard to Calhoun County, I think it was Calhoun County and how the work the panel did.
So thank you, Governor. So really, I think that the difference between some of the ways the map looks at the DHHR site and the school map that's posted on Saturday evenings is the fact that because we're posting it on Saturday, we have basically said Thursday at midnight is where the data component for the map that is shown on Saturday stops, so that then that provides a day, Friday, that allows the DHHR and epidemiology staff to be able to verify all the numbers, to verify that these are community spread events versus congregate spread events, to make sure there's no duplicates that are entered, and to make sure that we identify the county of origin of each person. So we make sure that we're allocating the case to the appropriate county. And we're also then looking at anything else that might impact that counting of a individual or a small group to one county versus another. And really, to go back to what the governor said, sometimes as few as one single case can determine whether a county actually falls into the yellow or the orange. When it came to When it came to Calhoun County, which was really the only change that the panel recommended on the Saturday meeting, the Calhoun County numbers were well below 20, and we know that having an aggregate of at least 20 cases, and for Calhoun that was over a 14-day period of time, is important for reproducibility. But from an epidemiology perspective, the small outbreak in Calhoun was among a group that were all isolated and quarantined. So the local health department felt that that was under control because there were still fewer than 20 cases, and because that was really the entirety of the sort of the color change from yellow to orange. Small population counties can be changed relatively easily to really support what the governor is concerned about. And so the panel then recommended that Calhoun be moved from the orange to the yellow. But basically, from a parent standpoint, if you just pay attention to the map as it's unfolded, that's really the best way to understand what's going to happen for the next week of school. And depending on what the modifications, the tweaks, as the governor said, emerge from the meeting that we'll have tonight, then some additional guidance may be available or will be available to explain what the new gold color might mean and where those cutoff metrics may be.
All right, thank you, Taylor. Next, we'll go to Mark Curtis with Nexstar Media.
All right, I'm here, guys. Sorry about that. I'm having technical problems too, Governor. Good afternoon, everyone. Governor, I received a number of texts and emails over the weekend, and I think this is a fair question given that you touched on both subjects here and the case of Monongalia County. But I have a number of high school parents in Mon County ask me, why is it fair to allow WVU to play a football game, but not the high schools? And the high schools are willing to do the same things that WV did: limit crowd size, limit bands, limit media attendance, limit parental attendance, and keep it small, but still play the games. And so they don't think it's fair.
Well, Mark, I would say just this. I would say what I tried to do before, and maybe going to make another run at the same thing, and that is testing. From what I understand, WVU is testing nonstop, as well as the other colleges and everything, and so I mean we could go into a lot of other different aspects of it, but I think two things. I think the testing is enormously important. I think the next part is that is really aiding them is their med school that's sitting there, that really is beneficial from the standpoint of WVU. But I also think just this, a lot of me would say it's a fair question and it's a very fair concern. Now, we've got Mon County that's blazing red right now and influenced a lot by the WVU numbers. We probably got to figure, we've got to figure out something, and everything. But from the standpoint of whether or not we should be playing high school high school football, and because, from the standpoint, it's okay to play college football, it's a very legitimate question to me.
All right, thank you, Mark. Next, we'll go to David Beard with the Dominion Post.
Hi. I was trying to consider the proposal how to deal with WVU as far as the counting it all students in quarantine as a congregate single number, and I thought that might be simple since I thought they were all quarantined in Arnold apartments, but when I look at the dashboard, it seems like it's more complicated than that. And maybe Dr. Marsh can answer this. Is you've got these isolation cases that are in Arnold, university apartments off campus, Greek housing. And then for quarantine, which is a separate listing, you've got residence halls off campus, went home, Greek housing. How is all that going to factor together and what you're thinking about for WVU?
Okay, Dr. Marsh, maybe you jump in and talk just a second. There's a real, we got a big time issue there, granted. The other thing is there is absolutely a differentiation, I guess is the right word, in what isolation is. You know, we're not getting the level of isolation that probably we should get, but Dr. Marsh, you jump in, please.
Well, thank you, Governor, and thank you, David. I mean, certainly we know that at the level of the university, and this is probably true of some of the other universities or other colleges in West Virginia, certainly is true of other universities and other states and cities. We have a group of folks who have come back to be on campus at WVU, and that is largely the freshmen who have come in and some more senior students, health science students, graduate students who need those types of in-person opportunities to continue to move effectively toward their degree granting program and requirements, so that they need to be on campus. And then there's another group of students who have rented apartments and rented houses, or members of fraternities or sororities who may well be in Morgantown, staying off campus, taking online classes that are not in that on-campus population. As we look at the isolation and quarantine, any student who is on campus will have the observation directly of the university and of the rules and approaches that have been set forth by the university, including testing upon entry and quarantining and isolation. The other group of students who may be detected are overseen in part with a connection to the university, but really are overseen more by the local health department that would oversee other people in Mon County or Morgantown. So there is a slight difference about the quarantining and isolation between these two populations. And certainly as we look at the Greek houses, there are a group of Greek houses that are affiliated with the university, and then there's a few that are not. So as you rightly point out, it's a more complex issue than just having one particular model only.
And Mark, if I could just add just this, and this is, you know, and again, there's so many moving parts, it's unbelievable, but this is going to be my opening comments in regard to WVU, you know, to the group of all the experts and everything that come in, and we come in at 5 o'clock. And it's going to be just this. All of us know that Mon County is bad. And all of us know we got a real life problem there, don't we? You know, if Mon County's at 38 today and we're trying to get Mon County, even if we add a color of gold, and we're trying to get Mon County all the way down to a 15 or less number, well, it's going to take forever and a day. And those kids haven't been to school. And those kids absolutely, and their teachers and all the people that are with them, you know, from the standpoint of athletics and everything that goes with it, it's a real problem. It is a real problem that we need to try to do something about. But on the other hand, the real problem is even magnified even greater because we got people dying. We got people dying, and absolutely, we've got to absolutely do the safest and the most correct thing. My whole thing is going to be just this. It's going to say things are really bad in Mon County. We got that, right? And the other thing is I would recommend that WVU, we find a way, and if we need to do it through the CARES money or whatever we need to do it, we need to do it because we are only protecting our people and especially looking out after all those and especially the elderly in Mon County. We need to test now every single person that goes on the WVU campus, everyone. And what we need to do from our kids' standpoint is come up with a way that we can quarantine or isolate the positive cases until we get some kind of resolution. And then how we count them is another animal into itself. But we need to do what is medically right first. Now, I know there's lots and lots of bells and whistles here, and it's more complicated than what I'm getting to, but it just seems just that simple to me. Test everybody, take all the positives, try to quarantine or isolate them for absolute certainty, and then take it from there. And if it means that our Greek houses are close enough to campus, test all of our Greek houses. If it means bring in the National Guard, do whatever we've got to do. We have got a very acute situation in Mon County, and it's hurting us in all kinds of different ways. It's hurting us in every way imaginable. We've got to do something about it. We've got to do it right now. So that's my whole thing.
All right, thank you, David. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Hi, everyone. Dave Mistich, West Virginia Public Broadcasting. My question is, with these active cases on the rise, we have the highest rate of spread in the country. Is there a worry that if we change these metrics, these protocols, add another color, that cases will continue to rise? And I guess my question is, how do we reconcile the idea of getting more kids back in the classroom with the understanding that if we open things up more, we may be opening ourselves up to more cases?
Dave, in any question that you may ask, there is always more concern. Always. You know, in the case of Monroe County, of just what I was just telling you, there's nobody in the world that can argue with me, and very successfully, that Monroe County is in the same situation today that Kanawha County's in. If we do not do anything, and I'm using that as an example, if we do not do anything in Monroe County, we stand a chance of losing 3 kids to whatever catastrophic thing could very well happen. We stand a chance of losing kids that are at risk from the standpoint of maybe sports is kind of holding them together. You know, we stand from the standpoint of helping the special needs kids there, or the kids that just need counseling and everything else. We stand ready to absorb a potential loss there as well. So if we go back to school and we tweak the color code, sure there's concern. Sure there's concern. You know, if there ever is a situation, dadgum if you do, dadgum if you don't, right here it is. But in that situation, just think about this just for a second, Dave, and it's just this. If we have a kid get sick in Monroe County because we went back, everyone will know about it. But if we have a kid that is lost, and a kid we lose because of some catastrophic situation, whether it be suicide or no matter what it may be, drug overdose, no matter what it may be, if we lose that child that way, we probably won't even know it. Well, that's not right. It's just not right. So the situation is really simple. To me, the orange is too wide. And to me, we ought to try to do something about that. And to me, school is important, really important. And we're getting behind. We're absolutely getting behind. And to me, also, sports are really important because they are a bond that exists forever from the standpoint of these athletes or band members or whatever. It is important. And so if it's important, we try to do something about it. In the situation that we're in today, anything we do causes some level of concern. If you've been in your house for 30 straight days and you go out in your backyard to check the dog one time, it's going to cause more concern. That's all there is to it. But we're going to try to absolutely continue to do the very best we possibly can.
All right, thank you, Dave. Our last question today comes from Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel, and thank you for your expertise. I want to go to Superintendent Birch for kind of a first week report card on how everything is going. You can have the best plan in the world, but without a playbook or any real idea of how it's going to be a test under fire. I'm particularly interested in how transportation issues have been handled at the local level. Superintendent?
Sure, I appreciate it. So the first week was last week. We had 46 counties open. This week we were up to, we have 47 counties live this week. Transportation, meals, in fact, not only meals in person, but meal deliveries and pickups have gone great. We had the announcement on Friday to add the additional protective gear for our nurses. We have the addition from last week of dollars the governor has generated so we can look long term to make sure we have supplies as long as they last. So honestly, everything we've heard for the first week and entering the second week has been nothing but positive. I think you hear each and every day the governor here talking about how important it is for these children to be in school. And I will tell you that it is, we get more discussion and phone calls from those not in school than we have with those in school. I couldn't be more proud of our teachers and staff and school systems for what they've been able to do to make that happen.
All right, thank you, Paul. That's all the questions we have. Governor, I'll turn it back to you.
Well, I want to follow up by Superintendent Birch and just say this, a special, really big thanks to all the county superintendents, all the teachers in all those different counties. And like we said, we were at 46 and now we're at 47 that are in school right now. We've got all the great work that the service personnel is doing in every one of these counties and all the other counties as well. You know, there's really no secret to anything. I mean, when you've got a well-oiled machine because all the people are doing the great work and you got a well-oiled machine, you don't hear a lot, do you? And that old thing, you know, that, when there's a clunker that's going down the road going boom, 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 boom and all that and everything, it's not going to last very much longer and everything, but a real well-oiled sewing machine is usually really clicking along really well. Now, there's going to be problems, and I'm sure there's already a few problems here and there and everything, but to take on this the way they're taking it on as far as all the teachers, like I said, service personnel, superintendents, all the different people from the state office and everything, all the different people that are doing these great licks. Miller Hall's been a superstar. I mean, for crying out loud, you know, Superintendent Birch and all of his staff is just unbelievable what they've done. But they need a lot of praise right now because I'm sure they're having a lot of sleepless nights as I am. And so nevertheless, I thank them and I'm going to end on that. We're going to have a good meeting at 5 o'clock. I hope we'll come out of it and make things better. But at the end of the day, what may very well come out of it is everyone saying that we've just double, triple, and quadruple checked, and what we're doing is right, and as best we can possibly do it. It may very well come out of it that we don't change anything, but I really do believe we're going to come out of it and make some tweaks that will make things better. Thank y'all.